Well, Joe, the magic number here was 216. About 20 minutes ago, the Democrats got their wish. We want to show you the reaction from the House.
The motion to concur in the Senate amendment is adopted. Without objection, the motion to reconsider is laid on the table.
This evening, they were chanting, "Yes, we can." In the end, the final tally was 219 yes, 212 against. Now the Senate bill goes to the president for his signature.
Speaker of the House.
House Speaker Nancy Pelosi arrived today with the same gavel that was used to usher in Medicare 45 years ago. Tonight, she was the last to speak before the historic vote.
Just think, we will be joining those who established Social Security, Medicare, and now tonight, health care for all Americans.
Shame on us. Shame on this body. Shame on each and every one of you who substitutes your will and your desires above those of your fellow countrymen.
It is one of the most sweeping pieces of health care legislation, and even at this late hour, there is still great division. The bill is not bipartisan. Republicans and Democrats at bitter polar ends.
I think the American people, once they understand what's in this bill, are going to start to like it. There has been an enormous disinformation campaign.
It's going to raise taxes at a time when we're trying to get out of a recession. It's going to cut Medicare by almost $500 billion. And I believe most importantly and most damagingly, it's going to lead to government control of health care.
The bill would cover the 32 million Americans currently uninsured and prevent insurance companies from denying coverage because of pre-existing conditions. But it also comes with a price tag, an estimated $1 trillion for the first decade.
We know the consequences of this bill will be frightening and horrible. Freedom dies a little bit today.
Underscoring how contentious this health care bill is, protesters this weekend yelled, "Kill the bill," at lawmakers. For a while, reform was considered dead on arrival, but thanks to last-minute assurances from the White House that the bill would not fund abortions, anti-abortion Democrats lined up behind the legislation.
With the help of the President, the Speaker, we were able to come with an agreement to protect the sanctity of life in the health care reform.
Now, Republican House Minority Leader John Boehner tonight asked for roll call to be taken for this vote. The Speaker denied his request. Experts believe that's because Democrats do not want their vote videotaped and used against them in upcoming campaign ads. Republicans have long argued that if Democrats force this overhaul on the country, they will pay for it in the next election. We are now waiting for President Obama to speak from the East Room. Sandra.
Lucy.
Thank you, Ida.
Yeah, and that's exactly right, DeMarco. As we were asking people outside for their thoughts tonight, the first question they had was, well, is it done? Not only has it been a long night, it's been a long year. People are weary and ready for a decision. Tonight, that's what they got. Late night voting on Capitol Hill, and here in New York, people were asking us what finally happened.
I think it's about time. I think Obama needed to put his foot down and get this done. I think that the public doesn't understand that this is in our best interest, without a doubt.
Congressional leaders from our area are praising what's being called historic legislation. Congressman Frank Pallone of New Jersey on the phone from D.C. tonight.
All these presidents, Democrat and Republicans, tried to implement a national health care system and weren't able to. So, I mean, the fact that, it's essentially, you could look at it and say it's 100 years since we started to do this, and it's finally happening tonight.
And Congressman Joseph Crowley from Queens on the floor during the debate earlier this evening.
Americans may very well be tired of the endless media coverage regarding this debate, but they know, as we do, that we have a serious problem when it comes to our health care system, that it must be fixed.
But as one side celebrates, the other stews. A number of people from our area aren't calling tonight's vote good news.
I'm not happy about it. The system needs fixing, but the way they're pushing it through, and there's so many different issues that aren't going to be resolved.
I guess you see what happens, you don't know. Maybe it will be good for the country.
I'm very disappointed in the vote. I strongly believe that this health care legislation is bad for the country. It's especially bad for the New York, Long Island region. And I believe it's just a dark day for America.
And that, of course, was Republican Congressman Peter King from Long Island, a longtime opponent of this health care bill. Overall, tonight, people are anxious, looking forward to see how things are going to change once and for all. Live in the newsroom, Ida Siegel, News 4, New York.
Well, one of the 212 Republicans who voted against it joins us now from Washington, D.C. Republican Peter King. He represents part of Long Island. Welcome, Congressman Boehner, the Republican leader, said that this will, good morning again, will ruin America. I was surprised to hear him say that, but he said it a couple of times. He thinks that this legislation, this law, could ruin the country. Do you agree with him?
First, Greg, let me just say, it wasn't just Republicans. It was also 34 Democrats that broke with their party bosses to vote against this legislation. I think this will be very damaging to our health care system. We have the best health care system in the world, and what we are now doing is moving it toward a European social democracy. It's going to have a devastating impact in the tri-state area by raising taxes at a time when we're in a recession. Those making over $200,000, over $250,000, that's a lot of money in other parts of the country. It's not in the New York, New Jersey, Long Island area. And at a time when the state and the city and the counties are in such dire shape, to raise taxes at this time is absolutely insane. It's wrong. And what we're going to do with the healthcare system, quite frankly, services are going to be reduced. It is going to diminish healthcare. And basically it's going to, I believe, create, instead of a healthcare system, one large motor vehicle system.
At least the bumper sticker version of health care, one could argue, is somewhat appealing. Let's go through some of the highlights. Number one, seniors get a break on prescription medication almost immediately. Small businesses get a tax credit to provide health insurance for their employers. Folks can keep their children on health insurance, their health insurance plans, until the age of 27, their 27th birthday. As far as the midterm elections go, they've got some selling points here, do they?
The fact is the overwhelming majority of the American people are against this. The fact also is that almost 85% of the American people have health insurance today. They have it already. And as far as taxes and small businesses, they are going to be seriously affected by this, which is why so many small businesses and so many business groups are opposed to it, because they know of the job-stifling impact it's going to have.
One thing I found interesting, the New York Times tried to make the case yesterday that what passed yesterday was even more, was milder, not as bold as what Richard Nixon, a person you worked for a long time ago, what Richard Nixon proposed in the 1970s. I mean, things certainly have changed.
Well, things certainly have changed if the New York Times is endorsing Richard Nixon. Fact is, in the world in which we live today, this is a very damaging bill, and to have such a large majority of Americans opposing it and have the President and the Speaker of the House ram it through by using every type of pressure tactic they could, to me it flies in the face of democracy. If you're going to have such a large change in 1/7 or 1/6 of the nation's economy, and you have a solid majority of the American people against it, that's just wrong. And I think we're going to see the results this November. I think it's going to have a devastating impact on the Democrats in November.
Now, before we get to November, and this is not the law of the land yet, the president hasn't signed it. There is still, I think, a reconciliation bill. I've heard some murmurings that the Republicans will try to repeal this or perhaps stop it, that there are options left. Are there?
You know, there are legal options as far as reconciliation, what's going to happen in the Senate. I think we have to assume that ultimately the bill is going to be signed. I think you will see a lot of states, though, bringing legal actions against it. It's to me, a stretch of the Commerce Clause of the Constitution to say that the government can require someone to take action. Yes, the government can regulate commerce. They can regulate commercial activity. I don't believe they can force someone to take action. The states can do it, but not the federal government. So I think you'll see, ultimately, this could be challenged. It is going to be challenged in court, and parts of it could be declared unconstitutional. As far as reconciliation, listen, we've seen over the last few weeks, whatever Harry Reid and Nancy Pelosi have to get done, no matter how they have to twist the law or twist the rules, they'll do it. So, unfortunately, I think it probably will be signed into law. It will be in effect, but then it will be challenged in court. And I think there's a very good chance that significant parts of it could be declared unconstitutional under the Commerce Clause.
All right, Peter King, thank you very much. They'll have to read it first if they're going to take it to court. It's big. Here it is. Nobody really reads all these things, do they? I mean, it's unpractical. I'm not trying to say that they don't do their jobs, but it is impractical to read an entire bill. A lot of this stuff is annex. A lot of this stuff is addendums and glossaries and that kind of thing. Is that fair to say?
Oh, yes. Listen, it's a practical matter. No one is going to read every bill. But you do have staff. And let me just say, on both sides of the aisle, Democrats and Republicans, we had our staffs working around the clock, analyzing it. And certainly, while I did not read every line of the bill, my staff briefed me on it. I looked at specific parts of it. And also, in fairness to Democrats, you will have Democrats on here this morning, whether or not they read every line of the bill, they were familiar. There's probably no bill in history that more people have been familiar with. This has been going on for a year right now.
All right. Peter King, Republican from Long Island, we thank you for being here. We'll catch up